Perfect. Thank you. Thank you everyone for joining us for our first round table. So we will be doing 3 round tables. If you were one of the individuals that signed up for the first round table, you can go back in and sign up for the other 2 round tables. When you sign up, you obviously get the 3 questions. If you have more questions, you could just email them to either Sean or I, and we will put them on the list. So what we've done is we took the list of questions that came in and we tried to put them together where we thought they belonged. We did have a couple questions, quite a few questions come in after the presentation was put together. So as those come up in between these questions, we'll go back and answer them as well. I don't anticipate we'll get through all the questions on these 2 slides today, as there are quite a few. And for those of you that registered for all 3 roundtables at the same time, some of your questions have gotten put in on these slides when they won't be answered until the 2nd or 3rd roundtable. So we have quite a span of different people on the call today. So we'll start with probably the more basic questions and work our way up towards the a little bit more difficult questions. We might not, again, be able to get to those till the 3rd roundtable. So if you have questions on what we're discussing today, just go ahead and put them in the question and answer box, and I'll try to get to those. Otherwise, we will print those off and get to them on our 2nd roundtable. So the first question we want to address is, what has changed? Well, as far as the reporting requirements go under the ACA, nothing has changed. So everything you did last year, you still have to do this year. So if you are a small employer who's self-insured, you still have the 1094 and 1095D filing requirements. If you're a large employer, you still have the 1094 and 1095C filing requirements. Nothing on those forms has changed. We do not have the draft forms out yet for 2019, so as far as if anything in the instructions has changed, we do not know that. We do not anticipate that, though. Your filing deadlines have not been extended yet. Remember last year they extended them right around, I believe it was Thanksgiving time. And the year before, I think it was that they extended it to the end of December. So you're going to want to be ready to get those forms out to your employees by January 31st. That is when they're due to the employees unless they get extended. If you wait until November or December to see if we have an extension, that's not going to give you enough time to turn those forms around and get them to the employees. We'll talk a little bit later about the penalties that are being released, but there is a penalty out there for 2017 on Form 972CG, and that's if you're filing those forms late. So if you're filing them to the IRS, if you're paper filing them, you have to get them to the IRS by February 28th. And if you are e-filing them, then that's the March 31st deadline. Remember, if you have 250 or more forms, you are required to e-file them. You're not going to be able to get out of e-filing them just by submitting them late and then asking for forgiveness afterwards. And that's part of where that 972CG is coming from. They're penalizing employers if they paper filed them and they should have e-filed them, or if they sent the forms in late. So again, watch for that deadline, see if that deadline is going to be extended. The past few years, remember, we got the extension for the deadline for giving them to the employees, but not an extension for sending them to the IRS. You can apply for a separate extension to send them to the IRS late, but it has to be done by the due date of those forms. I would suggest just trying to get them to the IRS in time. If you're getting them to the individuals by January 31st, you have all the information. You can, by all means, get them to the IRS in time. With that, I'm going to touch on a question we had later on about one of the questions that came in was, hey, why do we have to file these forms? A, why do we have to file the forms if there's no individual mandate? And B, why do we have to file the forms if the insurance company is providing that information to our employees? A couple good questions there. You're right, in 2019, for federal, there's no individual mandate. Be cognizant of what state you're in because some states do have a mandate. So the federal, there's no mandate. In Minnesota, we don't have a mandate. Most of the states do not have a mandate, but there are some that do. So why do you have to file the forms if there's no individual mandate? Well, you have to file the forms because the IRS needs to see if those large employers are offering insurance to get out of the pay or play penalties. So the employer mandate is still alive and well. Nothing has happened with that. And so that's why you have to report those forms to the IRS to show who an offer was made to and whether that offer was affordable or not. The individual mandate, that is what the 1095B form is for, as well as the third part on the 1095C form that large employers who are self-funded have to fill out. So far, that has not gone away, so you still have to file it. Remember, if the insurance company is filing it, that's because you have a fully insured plan. So if the insurance company is filing that with your employees and you're a large employer, you still have to file the 1095C form for Part 1 and Part 2. There's two different form filings, and that's a huge misconception out there that the insurance company is doing the filing, so the employer doesn't have to do the filing. It's two separate filings, so you're talking apples and oranges as far as what has to be filed. So make sure that if you're a large employer, you're filing those forms. I've not once seen an insurance company file the forms for those large employers. So with that, Sean, I will let you take the second question.
All right, so the second question is, as you can see there, is how do I report the data accurately? And then there was some sub-bullet points there concerning collecting Social Security numbers and date of birth from employees. And then there was another question or drilling down more into high turnover rates. So yeah, good question. It's obviously important to report and collect.
Sean, you are really echoing. It might be from Tonya's headset.
Oh.
Is he echoing now?
I can back up or something. Maybe I have to move. So the question is, how do I report data accurately in terms of the forms? So when you're gathering data, and
Sean, hold on one second. I'm going to go ahead and mute Tonya right now, and then just let me know when she's ready to talk, okay? And I will unmute her.
Okay.
Because you're just echoing.
Okay.
Go ahead.
Let me just, okay. So to report data more accurate, so there's a couple ways to address that. Obviously, you want to look at what data is important for the reporting, and in our book, from our experience, the most critical question to answer is whether an employee is full-time or not. And so you're looking at what the ECA defines as total hours of service. So you want to make sure you're including hours worked, but also hours that the employee was entitled to be paid. So that gets into PTO and vacation, those sorts of things. So having a process in place to gather that data is important. Looking at the hire and term dates is also important because that'll tell you when you need to extend an offer of coverage after a waiting period, and then termination, when that offer would end, whether it be on the term date or the end of that month. So that data is important. Also, we'll get into maybe if there's time later about rehired rules and break periods between a term and a rehire. That data element is important. So making sure that your payroll vendor can provide that data to you will be important. Also, they might have a tool that you can use for this reporting. We at Eide Bailey, we do have a model tool to use for the ACA reporting. So we gather hours by payroll period from anywhere from 12 months for the monthly method of reporting a full-time employee to actually 36 months or 3 years for the look back measurement period method, which we kind of expanded on the earlier webinar. We might have time to expand on that earlier or later in this presentation. But so gathering that data is important, and so we have a tool that we use for employers that want to outsource the responsibility of that and have more of a review function, and then we gather that data and compile it so that the forms are accurate. In terms of specifics around Social Security and date of birth, I mean, yeah, Social Security number, it depends on your hiring process and how you come about getting those Social Security numbers. We've seen a lot of different ranges of experience around this. We've seen industries where sometimes, they don't have a lot of turnover, so it's easier to collect that information. You do have to, if you don't know their social security number or the dependents, you do have to make a number of attempts to get that. And then after that, you can use the date of birth on the form. So that might be where that question is stemming from. So you can use the date of birth if the social security number isn't available and you've made attempts to collect it. Regarding high turnover rates, that is an area where if companies have high turnover, they'll want to make sure that, that gathering that hire date and term date and rehire date, if you have rehired amongst that turnover, is pretty important, because if that term to rehire, also as a break period, is shorter than 13 weeks for that employee, then that employee comes back on that rehire date, they resume the status they had before the termination. So that'll be important to track and make sure that that period is greater than 13 weeks. And then high turnover is just, when do I offer coverage for employees that just came on? If I have a lot of turnover, that depends on which method you use. If you're using the monthly method to determine a full-time employee, or the look-back method. So, obviously with the monthly method, you track hours each month, and then once that employee becomes full-time, that kind of triggers a waiting period. And kind of a good rule of thumb is we tell clients is you can use either 60 days or 2 full calendar months as a waiting period, because it makes sure that your waiting period isn't too long. There's an ACA rule that says it can't exceed 90 days, so you want to make sure that you're doing that. So either 60 days or 2 full calendar months helps with that. And then you offer coverage, the first of the month following that. So with that, I'll turn it back over to Tonya.
Perfect. Thank you, Sean. So with that, since Sean has touched on a little bit of the rehire rules, we'll probably go into them a little bit more in depth later. I always tell clients, if I've got clients out there that are large employers, and they keep under 30 full-time employees. And why they do that is because, remember, a large employer is someone who has 50 or more full-time equivalents. We'll talk about that in a minute. But once you become a large employer, and it's applicable large employer, ALE is where you'll oftentimes see that written. Once you're an ALE, if you want to avoid the penalties, you need to offer affordable and adequate insurance to your employees. Now remember, every full-time employer gets 30 free employees. If you're part of a controlled group, every person in that, or every entity in that controlled group does not get 30. You have to divide that 30 up each month according to your full-time employees in each entity. So going back to that 30 number, if you stay under 30 employees, you'll never have a pay or play penalty, because you always get 30 employees free. And remember, the higher of the 2 penalties, that 4980HB penalty, is limited to the 4980HA penalty. And that A penalty is the one that penalizes you for not having insurance, but you always get 30 individuals for free, so to speak. So when you're talking about that, if you don't offer insurance and you're trying to keep close to the 30, I've got some people that have 35 full-time employees, and it's better for them, so to speak, economically, to pay the penalty on those 5 employees that are over than to go ahead and offer insurance to the entire 35 employees. So if that's what you're trying to do, or if you're not going to have insurance, you have to know that if you don't offer insurance, you don't get that 3-month waiting period. And that's a huge misconception out there. They think, well, if I hire someone, I get that 3 months of free no penalty months. If you hire someone and you don't offer insurance, there's no waiting period. So if that is the type of employer you are, you're going to want to hire someone not on the first day of the month. So if you hire them on the second of the month, that gives you that month free of penalty. You'd have a code that you can put in for that month, so it avoids penalty. On the same token, if you're that employer and someone's going to terminate, or you're going to terminate them, make sure that they terminate the day before the last day. If we're in March and you terminate them on March 31st, they've worked for you for the entire month. If you terminate them on March 30th, you've got a code that you can put in there to avoid penalty for that month. So my next question, as you can see here, was was what are the filing requirements. I think we touched on that a little bit earlier. Just make sure that if you are an ALE, that you are filling out those forms, 1094 and 1095 C forms, and you're doing it timely. Like I said earlier, that's the big misconception out there, that the insurance companies are doing it for you. So with that, Sean, I will pass it over to you for the next question.
Thanks, Tonya. So the next question is asking, to who and when do I offer health insurance or coverage? And it's a good question, because that gets to the crux and kind of what we talked about earlier about the reporting data accurately. So the ACA says if you're offering coverage, you need to offer coverage to your full-time employees. So that's who. And then there's two methods to determine who's a full-time employee. I alluded to that a little bit earlier. So there's the monthly method, which is looking at hours for each month. And again, like I said earlier, once they triggered a full-time in a month, so say I'm part-time in January, February, and then in March, and I was part-time throughout my employment period, and then say in March I become full-time. Okay, now if I have a 2-month waiting period, April and May are the waiting period, and then I need to be offered come that June 1st, I need to be offered coverage. Even if I become part-time later in that calendar year, I still need to be offered, because I could be full-time in a subsequent month, and then I'd need to be offered. So once I trigger as a full-time employee, best practice is to install or put in place that waiting period, and then make an offer the first of the month after that waiting period. And then the other method is that look back measurement period method. So you can look at employees over that measurement period and see if they're full-time, and then extend an offer of coverage over that subsequent stability period, which we kind of deciphered or kind of flushed out what those rules were in the earlier webinar. And due to time, I'm not going to go over too much, but a good rule of thumb for the measurement period is to use a 12-month is what we recommend, just because if you have a part-time employee that is often, we see this a lot where they're full-time maybe for a few months throughout the year, but then they're part-time the rest. Well, like I said earlier, under the monthly method, they'd be full-time, and you'd have to extend an offer. But under the measurement period, they'll be averaged over those 12 months as part-time, and then you won't need to extend an offer because they will be defined as part-time there. So when do you offer coverage? I kind of said about that. It's after the waiting period. So once they are triggered as a full-time employee, in either method, you have your waiting period, and like we said, we recommended as a rule of thumb either 60 days or 2 full calendar months as your waiting period. So use that as your waiting period. I mean, you can use less if you want. Just you don't want to trigger the 90-day rule within the ACA that says your waiting period can't exceed 90 calendar days. So 2 months, and then after that you would extend your offer on the first of the month after that, and then you would have an offer to those employees. And the reason why it's important is to get around let me phrase it another way. So the ACA defines an offer of coverage as an offer to substantially all full-time employees. And then they further define that as an offer, we talked about this on an earlier webinar, as 95% of your full-time employees. So you need to make sure you're offering to 95% of your full-timers each month of the calendar year. So I've seen it where clients under the monthly method think they're offering to all full-time employees under monthly, and then we did the math and we did the analysis of the model, and we figured a couple months they were under 95, and that became an issue for those clients. And so we had to go back and go through the data and try to figure out if they're actually above the 95%. Otherwise they could potentially have that penalty, the $2,000 time all full-time employees for those months they were under 95. So it becomes important to make sure to who's full-time, and when you're making those offers to those full-time employees. And so with that, I'll turn it back over to Tonya for the next question.
Perfect. Thank you, Sean. And to kind of piggyback off of what Sean said, when you're using that look back and you have someone who's you hired as variable and they're working variable and their hours are up and down, and maybe they hit some full-time hours in some months and back down to part-time hours, and at the end of your 12-month period, they hit under 1560, you can make them an offer, But that 1560 is saying, hey, listen, they're not full-time under the ACA rules. So because you make them an offer doesn't necessarily mean that you have to give them a form. Remember, every form you put out is a potential penalty coming back in. So if you're using the look back and someone's hitting 1550 hours, if you have a fully insured plan, you do not give that employee a form. If you're self-insured, you'll want to list that employee on that form as a part-time employee, which would be a 1G code. And that's telling the IRS, hey, listen, we're giving you this form just to report that information in Part 3 about the employee, potentially their spouse and dependents that were covered and the months they're covered, but you can't assess us with an ACA penalty because they weren't full-time any months of the year. I didn't have anybody ask about any of the codes, so we really won't go through any of those codes. If you have questions on those, send me an email. We'll put it in the latter slides for probably Roundtable 3. But when you're using that 1G, I should tell you that 1G has to be used for all 12 months. I see that over and over again, or people will use a 1G for maybe 3 months of the year, and then a different code or no code for the remainder months. If you're using a 1G, it has to be used for all 12 months. So with that, I'm going to go on to the next question, and it says, what does 50 full-time equivalent mean, and how do I know if I'm full-time equivalent? So back before the beginning of the year, you can calculate your ALE status, and that's at 50 full-time equivalent. And now we know a full-time employee, once we're in ALE, is 130 hours a month. 30 hours a week times 52 weeks a year divided by 12 gives us 130 hours a month. But when we're calculating whether or not we are an applicable large employer, that hour threshold is actually 120. So, and it's always based on the prior calendar year. So how would I know if I'm an ALE for 2019? Well, you would have known that back in 2018 because you'd have looked at all of your 2018 months and you'd done the calculation. And how that calculation is done is you look at every month individually. So you look at the month of January of 2018, and everybody who has 120 hours or more is a full-time employee. They're counted as one. Whether they have hours over that 120 mark or not, it does not matter. They just count as one full-time employee. Then I always think of it in buckets. In that second bucket, you put all the hours of everybody who's under 120 hours for that month of January. You divide that bucket by 120, and that gives you your equivalency. So you take that number of full-time people in bucket number 1, then you take your calculated amount of equivalents in bucket number 2, you add those two together, and that is your number for January. You repeat that process for all 12 months, add up your 12 months, and divide it by 12, and if you're at 49.99, then you're fine. You're not an ALE. You would only have a reporting requirement if you have a self-funded plan, and that would be on your 1094, 1095B forms. If you're an ALE, then you'd be 50 or more, you'd have the C form filing requirement. Remember, when you have someone who is a related entity, you have to bring in those numbers to do that 50 count to see if you're an ALE based on those numbers. So I think that takes care of that question. So with that, Sean, I will turn it over to you.
Okay, thanks, Tonya. And that's good to talk about that related entity. Sometimes that gets missed on that in the control group rules. So like you said, like Tonya said, you got to add up all the different companies together that are related under common ownership and see if you are above that 50 threshold. So that kind of leads into the next question, actually, of how do I stay under the 50 employee equivalent. I wonder if that was the same person, but in any way, you just want to check the hours of service that you have, total hours of service. Again, make sure that your hours are right, so you're including PTO and vacation, those things. And then the other thing is just keep track throughout the previous calendar year and track your hours by employee. And so you just monitor each month and see, am I getting closer to 50 full-time equivalent employees on a calendar year basis, or am I not? And one thought some organizations might have as well. I'll split that staff, that full-time staff, into 2 part-time. But as Tonya laid out, problem with that is you're dealing with the equivalency piece. So by the time you add up those hours on the equivalency part, that's going to be, a full-time employee of 1. So it's still going to get you to the same answer as if the position was full-time. So just watch the staff if you're close. We've had a fair amount of clients that have been approaching the 50, and I've asked some questions around it. So you just want to watch it. The other part to consider is, which sometimes is missed, is the seasonal rule. So there's a seasonal worker rule. And so if you're an organization that has a heavy winter business or a heavy summer business or something like that, where it's 120 days or less, which basically is 4 months, if that period of time or that season is the reason why you're over 50, then you can use the seasonal exemption that will cause you to not be an applicable large employer. So that's another little piece for a lot of businesses that gets them to not be an ALE even though they are. Well, if it's due to 1 season, not 2, we've had companies that have 2 seasons. It has to be 1 season, 1 4-month season that makes them over the 50. Then if you take that into account and exclude that season, then they're no longer over the 50. And with that, to keep time moving, Tonya, I'll kick it back over to you.
Perfect. Okay, so I'm trying to keep up on the chats here. I see one chat says the seasonal was missed. So let's talk a little bit about that. So there's a seasonal, you have to be a seasonal business. So you can't have 2 seasons. I had someone, actually several clients had told me in the past, well, I have 2 or 3 seasons. Well, you can't. If you're a seasonal business, you have 1 season. And there's a seasonal worker and there's a seasonal employee, and oftentimes those 2 are getting mixed up. So the seasonal worker, that is someone that works 120 days or less, doesn't have to be consecutive days. And if you're a seasonal worker, that is on the ALE calc. So let's say I do the ALE calc and I end up at the end of adding up those 12 months, I end up at 52. And then I take a look at my workers and I see, hey, listen, I have seasonal workers here and I've got 4 of them. If I pull them out, do I get under 52? Absolutely. I'm at 48. If they were working at average, you wouldn't get to 48. You might get to 50. It would depend on how your averaging goes, because remember, you're averaging each of those months. The basis for the seasonal workers, if you pull those seasonal workers out and that ALE calculation drops below 50, you are not an applicable large employer and you will not have a filing requirement. So again, the seasonal worker is 120 days or less. Those 120 days do not have to be consecutive. Seasonal employee is 6 months or less, and that is after you're an ALE and you're a seasonal business. Do you have workers that work 6 months or less? If you do, you do not have to offer them insurance even though they're full-time within that 90-day period, because they're a seasonal worker. They're not going to work for you the whole year. That caveat under that seasonal employee is that it's a 6-month time period. You can't move that around for each employee. It's the seasonality of your business. The problem with that is some of those employers will hire those seasonal workers on and they won't actually end up being a seasonal worker, because they might have hired them in April anticipating that they're going to only work 5 months, but then they were a good worker, so they keep them working. They never offered them insurance because they anticipated them to be a seasonal employee. Now they've exceeded that 90-day threshold and they're not a seasonal employee because they didn't end up working 6 months or less. So be cautious of that. If you're testing someone to see how they're going to work, you can't really call them a seasonal employee because you might want to keep them on and then exceed that 90-day. Now, one thing we didn't touch on when you're looking at your ALE status is we have a lot of business out there that are going through an acquisition or a merger. So if I have 40 full-time equivalent employees and I merge with a business, let's say September 1st, and they have 20. I now am a large employer for this year. I don't get to wait until the following year and do that ALE calc. Same thing as if I'm a new business. If I start a new business in September of 2019 and I anticipate hiring 50 or more full-time equivalent employees, I'm deemed a large employer. I don't get to wait a whole nother year and then average it out, because obviously if I averaged it out January through August, I would have 0 employees, which would bring down my average. So again, a new employer or an employer that's purchasing another entity, you're going to have to look at that 50 requirement in that year. You don't get to take and wait another year before you look at that. So I know we're at 10:30. I'm going to just touch briefly on the ESRPs. I will touch on them again on the next call, just because these ESRPs have a 30-day turnaround. So I want to just touch on them really quickly. It says we're currently fighting an ESRP. What about the penalty abatement? When you're doing an ESRP, you should know that the IRS is starting to come down a little bit harder on 2017 and forward filings. If that is you, you're getting a 2017 ESRP from the IRS. That's letter 226J. They are running behind as far as when they will look at those. I recommend, so when we answer the ESRPs, we send to the IRS everything so that they can be closed once the IRS reads our letter. If you don't send them enough information, they could send you a letter and they could send you a 227L and revise the penalty. Maybe it's because you didn't submit enough information. Maybe it's because you submitted the wrong information. Oftentimes we see people submitting the wrong information. They're not understanding the reason that they're getting penalized. So the IRS isn't going to move that penalty around or abate it. So when you answer those ESRPs, make sure that you're showing proof that the employee was full-time, that that you had affordable and adequate insurance. If you're part of a controlled group, I'll tell you right now, your ESRP is going to be wrong, most likely. The IRS isn't dividing those full-time employees per entity correctly according to the regulations. They're going to wait for you to respond back and ask them to change that percentage, and then they will. But the way their computer system is designed is it divides that 30 up equally by all the entities, not according to the full-time employees in each entity. So if that's you and you're getting one of those ESRP, make sure you show that calculation in an Excel spreadsheet to the IRS, submit it so they can change that penalty around. You will probably get a letter from the IRS office asking for an extra 60 days to go through that. No worries, they're just running behind it. Everybody's getting that letter. Only thing I can add to that is if you're fighting the SRP, you don't get the abatement or the reduced penalty like you thought, by all means, contact me and we'd be more than happy to step in and help you. We have done that with clients where they get a 227L, or maybe they're getting a 227M letter in, and there's no change. If that's you and you feel like there should be a change, give us a call and we'll respond to that IRS notice and see if we can help you out there. So with that, Amy, we're sitting 3 minutes past our half-hour mark. I'm going to table all the rest of the questions and we'll answer them in roundtable number 2. If you are part of the chat that are going on right now and we didn't get to you, we'll put those in on the second roundtable. Or you can email questions to Sean and I, and we'll put those on the second roundtable as well.
Awesome. All right. Well, thank you all so much for attending, and we look forward to seeing you on the next one. Thank you, Tonya. Thank you, Sean. Everyone have a great day.